So again, for the implementing rules and regulation, Quarantine Act of 2004, which is pursuant to Republic Act 9271. This is the Administrative Order Number Series of 2005. So for the continuation, which is the Part 5, the inspection of aircraft upon the arrival from foreign airports, the Part 6, which is the requirements of domestic aircraft, and Part 7, which is the detention of conveyance in quarantine. So, under the Part 5, which is entitled The Inspection of Aircraft upon arrival from the foreign airports. In Section 29, all aircraft from the foreign airports are subject to quarantine inspection upon the entry in any airport of the Philippines. Those aircraft are cleared in one airport in the Philippines are deemed clear for all the airports in the country, except in any cases of any aircraft with any infectious disease which is subject to the regulations, emerging disease, public health emergencies of international concern, and or deaths on board. Under the Section 30, this is the requirements of the aircrafts to be inspected. Any aircraft from the foreign ports are bound to the Philippines shall land first at any airport of the entry, unless their permission to land elsewhere is first granted by the appropriate authorities. It shall be the responsibility or of any airline company which they are operating the aircraft engaged in the international flights. Such notice shall specify the following: for the requirements of the aircrafts to be inspected, the date and time of arrival, the type of aircraft, the flight number and the registration marks of the aircraft ID, and the airport of the origin. Under the Section 31, this is the requirements from the commanders of aircrafts to be inspected. Those cases of infectious disease subject to the regulations of health emergencies of international concern occurring at the airport or program, the airport commander of the airline representative must inform the Bureau of Quarantine before the arrival of the board. The transport of patient passenger who are medically evacuated, regardless of the nature of the case, he shall also provide the passenger list and seat number, cargo manifest, aircraft configuration to the quarantine medical officer on duty and facilitate the medical examination. Under the Section 32, which is the boarding of aircraft placed under the quarantine. In case of notification of the presence of suspected cases of infectious disease, there shall no person is allowed to embark except the quarantine medical officer and or his accredited assistant. Passengers shall not be allowed until such time that the aircraft is being granted for the quarantine clearance. And in any cases when the aircraft is exposed to RBC, the radiological, biological, and chemical terrorism, the tailored action on such incidents should be followed in accordance with the interim guidance and preparedness of response. Under the Section 33, all aircraft shall be disinfected in accordance with the rules and regulations of the World Health Organization. The vector control for aircraft. The aircraft shall be disinfected after the disembarkation of passenger. The cabins, cockpit, baggage, compartments, and other places in the aircraft shall be sprayed with an approved type of aerosol insecticide. A lieu of this and a fine vaporization from a hand sprayer of recommended insecticide. So the requirements of aircraft before departure, which is the Section 23, no aircraft shall be allowed to depart from any airport of the Philippines to foreign destination for them without them securing an outgoing quarantine clearance from the Director of Quarantine. Why? Because this clearance shall be granted to the aircraft on condition such an aircraft has observed all quarantine requirements imposed, that this clearance shall be a requirement for the granting of a custom clearance for departure. Under the Part 5 of the Section 35, this is the embarkation of the travelers for international flight. It said that the director of the quarantine, when he considered it necessary, may be the medical examination of travelers, and may disallow of any suspected person that has the infectious disease that subject to the regulation of emerging disease. For the concern from the embarking on any international flight, except in any cases of transport of 6 persons by a conveyance which especially provide for the purpose in order to safeguard the health of the passenger and crew. The Section 26, this is the quarantine inspection of aircraft. This shall be conducted by the quarantine of medical officer or his duly assigned director of quarantine. In the airport where there are no quarantine medical officer, a duly trained physician will be designated, and who shall perform such function in annual contractual basis is the officer upon the recommendation of the director of the quarantine. The time of the aircraft quarantine inspection upon the Part 5 and the Section 27, this inspection of aircraft required by this regulation shall be made upon 800 to 1,200 hours and 1,300 to 1,700 hours from Mondays to Fridays. Any inspection performed outside these hours or during the Saturdays, Sundays, and holidays shall be compensated for. Hence, there are reasonable reimbursement by the concerned airline may be allowed by the director of the quarantine in relation to the incurred expenses and service rendered by the quarantine personnel. So, the Part 6, this is the requirements of domestic aircraft. In Section 38, all the domestic with the existence of infectious disease are subject to the regulation of emerging disease. In ports where there are no quarantine officials, inspection and clearance of this aircraft will be coordinated with the local health authorities. This is the requirements from the commander to the aircraft to be inspected. Those cases of infectious disease, international concern occurring in the airport of origin, the person with illness on board, or the person who is suspected who have an infectious disease subject to the regulation or the death on board, he shall also provide the passenger list, seat number, cargo manifest, aircraft configuration to the quarantine medical on duty or the facilitate of the medical examination of the passenger and by the crew by an officer on duty whenever necessary. Under the Section 40, the director of the quarantine may from time to time prescribe or require immunization from the certain disease if in his discretion such requirements are essential or account of varying public health conditions. So this is for the Section 41, and this is for the domestic flights. The director of quarantine may disallow the embarkation of any suspected person having a contagious disease or infectious disease, which is subject to the regulations of emerging disease and or the public health emergency in the international concern in order to safeguard the health and of the crew and the passengers. So who is the person assigned for inspection of the domestic aircraft under the Section 42? The quarantine inspection of domestic aircraft shall be conducted by the quarantine of medical officer and or his duly accredited assistants. A duly trained physician will be designated under the Secretary of Health as an acting alternate quarantine medical that they are the recommendation of the director of the quarantine and shall perform such function on an annual contractual basis. So under the Section 43, in case of notification, the suspect cases shall be medically evaluated at the holding area and transported to designated referral hospital of isolation. The public health emergency of the international concern or that on board there is no person is allowed to embark except the quarantine medical officer. Any person who enters the confines of the quarantine inspection area during the quarantine inspection of passenger without permission of the quarantine medical will be subject to quarantine restriction. So, the Part 4 of the implementing rules and regulation of the quarantine, this entitled the detention of conveyance under the quarantine. Under the Section 44, the conveyance of the place in detention, any vessel or aircraft which the director of the quarantine determines and considered to be the infected with disease is subject to regulation, emerging disease and or public health emergency of the international concern shall be detained in quarantine. Under the Section 45, There should be no conveyance under the quarantine that is allowed to move or maneuver without the permission of the director of the quarantine. This vessel under quarantine shall fly a yellow flag while under the detention. So section 46, this is for the detention of persons. Those persons on board of the conveyance under the detention shall be subjected to the restriction imposed by the director of the quarantine. So there shall no person allowed to go outside unless the quarantine is done and permitted.